Madam President, I come to the floor today, as I have week after week since the health care bill was signed into law, with a doctor's second opinion of the health care law. I do this as someone who's practiced medicine, taking care of the families in Wyoming as an orthopedic surgeon for 25 years, as someone who's been the medical director of the Wyoming Health Fairs to help give people low-cost blood screening so they can have early detection of medical problems, to help them find problems early, and then early treatment following early detection is something that always works to keep down the cost of their medical care. So I come to the floor today to talk about the fact that we have seen again this week a new development. And the development this week is that the American people have spoken up. They've done it in the Show Me State of Missouri. The Show Me State has shown Washington they have rejected the president's takeover of the health care system in this country. Like so many Americans, voters in Missouri are sick and tired of Washington forcing things upon them, telling them what they need to do, and now telling them what they need to buy, specifically in terms of the federal mandate, mandating that people have health insurance, that they must go out and buy that or face penalties, taxes, fines related to the fact that they make a choice to not buy health insurance. And I think that voters are also tired of being ignored by Washington. And that's why 71% of the voters in Missouri on Tuesday, 71%, over 7 out of 10 who went to the polls, rejected the demand by Washington that they be forced to buy a product, to buy health insurance. It's part of the law. It's the mandate. They have to have health insurance, have to buy it. So how did the White House respond to this rejection of what has now been forced down the throats of the American voters? Well, Robert Gibbs was questioned on this during the White House press secretary, our White House press secretary during a White House press conference. And it was asked what it means that voters in Missouri would vote against this federal mandate. And Gibbs said nothing. It means nothing. Well, to the voters of Missouri who I've talked to, this is an insult. It does mean something. They have expressed their opinion, and the White House said, your opinion means nothing to us. So instead of trying to address the concerns and fix the new law, the White House seems to be right now more focused on a slick public relations program. They have a whole campaign going. And it's interesting because the people of Missouri are not the only ones who are opposed to this law. Voters later in this year in a couple of other states will be voting as well on the impact and the mandate. Well, a new Rasmussen poll out just this past week says 57% of Americans, I'm talking about likely voters, and that's how they poll this, likely voters said that this recently passed health care law, in their opinion, is bad for our country. 57% of Americans feel that the law that was forced down the throats of the American people, with the American people screaming, do not pass this law, even today, 57% of Americans, as they learn more and more about what's in the law, they believe it is bad for the country. That is actually the highest level of pessimism about this law since the law was passed in March. Now, support from the law continues to erode. So what happens? Well, the White House comes out with a public relations campaign. And once again, they are setting their sights on American seniors. They did it with a very expensive, glossy mailer that went out to the seniors on Medicare. It looked to me like a propaganda piece, very misleading. Once again, they are focused on the seniors. And why? Well, because the seniors are those who are most opposed to the new health care law, the one that takes $500 billion away from Medicare, not to save Medicare, the health program for our seniors, but to start a whole new government program for someone else. So this week, what happened? At the end of last week, the new director of Medicare and Medicaid, Dr. Berwick, and we've talked about him on the Senate floor. He's the one who had a recess appointment, the one that is in love with the British healthcare system, the new director who had the recess appointment, who has never come to the Senate to share his answers with the American people. The American people have been denied the right to hear from him. But he did have time, didn't have time to share with the American people his views, but he did have time to introduce a slick new ad campaign to try to sell the new law to Medicare patients. Healthcare law is out there now being promoted in a television ad for which the American taxpayers are going to have to pay the bill. The American taxpayers are going to pay the bill, and the ad stars Andy Griffith. During this ad, and we know Andy Griffith from the Andy and Mayberry, the television show, and later years Matlock, and he is used as the spokesman now to our seniors, telling seniors a number of things, making a number of promises. And let's go through them. One is he says that seniors will have their, quote, guaranteed benefits. Well, only in Mayberry does a $500 billion cut equal better care for American seniors. And now, even the administration's own actuaries and own specialists and Medicare take a look at this, and they don't even agree with the commercials. They say that the cuts are unlikely to be sustainable over time. They say that 1 in 6 hospitals and doctors' offices related to Medicare providers, they're going to become unprofitable within 10 years. Many may be forced to close. And they say that the new law is going to jeopardize patient access to medical care. Well, then Mr. Griffith says, well, more good things are coming. That's the quote, more good things are coming. Well, what kind of things for our seniors on Medicare? When you take a look at how the cuts are out there are cuts for home health, which is a lifeline for seniors who try to stay out of a nursing home. There are cuts to nursing homes for Medicare. There are cuts in physical therapy. There are cuts to hospice, where many people spend the last days of their life. Cuts across the board. I don't know how that can be related to more good things are coming. The President's Medicare experts tell us that benefits aren't going to remain the same because things with happening with Medicare Advantage. 1 out of 4 people in Medicare, 1 of 4 people on Medicare are signed up for Medicare Advantage. And the reason they do it is because there is advantages of being on Medicare Advantage in terms of preventive care, in terms of coordinated care. There are good reasons that people sign up for that, but yet there are going to be cuts there. In the commercial, they also say that the law will lower prescription costs, but the Congressional Budget Office estimates that that's not true, that the cost of prescriptions will continue to go up. So, you look at this ad, and then there are people that look at ads, political ads, different kinds of ads, and there's an organization called factcheck.org. And what they did is they said that this commercial uses, in their words, are weasel words, they say, to avoid telling the truth. Well, that's the fundamental problem here. As much as most of Americans love to hear from Andy Griffith, we'd prefer to hear the truth from President Obama. Instead of spending hundreds and hundreds and hundreds of thousands of dollars of taxpayer money on a misleading ad, the President should put this money toward the $500 billion that has been cut from our seniors on Medicare. Now, the White House continues to believe that the American people don't understand what's in the health care law, and they say that's the reason it's unpopular. They say if more people understood the law, well, then it would be more popular. But week after week, something else comes out, another broken promise that make people realize that this isn't good for them. It's not good for them as patients. It's not good for the providers, the nurses and doctors who take care of the patients. And it's not good for the payers, the people who are paying for their health care, the taxpayers of America. Across the board, people realize, as they learn more and more about what's in this law, they realize it's not good for them. And when I go to senior centers and visit with seniors, I say, how many of you believe that it's going to cost you more for your health care? Every hand goes up. And then you say, how many of you believe that the quality of your care is going to go down? Every hand goes up. And you see the same thing if you go to a Kiwanis Club or a Lions Club or a Rotary Club, civic organizations, whoever you visit with. Do you think the cost of your care is going to go up? Every hand goes up. Do you think the quality of your care is going to go down? The hands go up again. And that's not what the American people want, paying more and getting less. Well, I think the American people are really getting a good understanding of what is in this bill, and The people of Missouri have clearly reflected that Tuesday in the voting booth. Earlier this week, I joined Senator Coburn, the other physician in the Senate. There are only 2 physicians who serve in this body. I joined Senator Coburn and other members of the Senate in sending a letter to Secretary Sebelius, the Secretary of Health and Human Service. And what we requested is that the department stop running this ad, reimburse the U.S. Treasury for any taxpayer money spent on the ad. Now, explain which one of the accounts in Health and Human Service paid for this advertisement. And you take a look at this. We as a nation are $13 trillion in debt, and the White House's ongoing propaganda campaign should not be funded by American taxpayers. And that's why week after week, every week since this bill became a law, I've come to the floor to give my second opinion about the health care law and to say that it should be repealed and replaced. Replaced with something that is patient-centered, not government-centered, not insurance company-centered, but patient-centered. Allow people to buy insurance across state lines. That'll help get down the cost and will help allow more people to be insured. Give people the opportunity who buy their own health insurance, give them the opportunity to have the same tax breaks as the big companies get. Give people that buy their own health insurance and others opportunities through nutrition and diet and exercise and taking responsibility for their own health care. Let them reap the benefits of that. And then, of course, we need to deal with lawsuit abuse and the expense of all of the unnecessary tests, the defensive medicine that doctors all across the country will tell you that they end up practicing. Those are the things we need to do, and opportunities for small businesses to join together to get down the cost of their care. With the individual mandate that's out there and the business mandate, we're seeing more businesses saying, you know, I'm not going to want to provide health insurance under this new law. Just pay the penalty and go on. And that's going to make it harder for people. So here we are with huge national debt, high unemployment, and a health care law that, in my opinion, would best serve the country if it was repealed and replaced. And that is why, Madam President, I come to the floor again today, the last day the Senate is in session, as senators are heading out around the country to visit with those in their communities over the month of August. And I am hoping that the American people continue to speak out and tell their elected representatives that it is time to repeal and replace this health care law. Thank you, Madam President. With that, I yield the floor.